Report from the President and CEO. David, I'll turn it over to you.
Thank you, Madam Chair. I am now sharing my screen. So welcome back officially, even though you haven't left, because we had a half-decent busy summer from a board perspective and some of the issues we had to deal with. So what we want to highlight tonight is kind of an update where we are, because it's always a question, especially at this time of the year, where we are with respect to influenza, COVID, and RSV. So I'm going to take the influenza piece. I'm going to hand it over to Dr. Saad for COVID, and then to Karen Riddell for RSV. So traditionally, what we look at when we deal with influenza is what happened in Australia. Is traditionally, Australia has their influenza season in our spring and summer, and what happened during that time period is reflective of what we're supposed to be expecting. So if you look at the one year, which was last year, is this tan or orange line here. It shows the season started earlier, the increase, and it was a dramatic increase, if you recall, but also it turned into a dramatic decrease. So it went up. It was in effect about twice as high, if not 70% higher than their 5-year average. But then the descent was rapid. However, the impact was rather large. So if we go to their hospitalizations, oh, sorry, I skipped over what this current year was. If you look at what happened in 2023, though, which is this year, is the red line. So it started a little bit later than last year. The incline is not as great, and the peak is somewhere about half of what it was last year, with a decline as well. So it's larger than, past years, but half as last year. So if you're comparing it to historical averages, it's still high. It's still an early year, and these are confirmed cases. The issue is hospitalizations, unfortunately. Again, started a little later than last year. These are Australian numbers again. You'll see the Australian numbers peaked. The number of hospital admissions for influenza is the tan or orange. This year, the number who was admitted was higher and lasted longer than last year. So even though the number of influenza positive cases was less, the hospitalizations were more than last year and lasted longer than last year. What does that say? Is the testing as prominent this year as last year? Really, the hospitalizations are the true data point, because they're coming into the hospital and they're being tracked, as compared to just the previous slide, which was general testing, which is dependent upon people getting tested positive in the community and elsewhere for influenza. So, the good news I gave in the first slide is replaced by not so good news in the second slide, and what we could possibly expect. So if you look at for ourselves in Canada, what happened last year, again, similar to Australia, earlier start, the dotted line is the average. For the last 5 or 6 years. This dark blue line is last year's. Again, it was earlier. Similar to Australia, a big peak. Similar to Australia, a big decline, a quick, rapid decline as well. However, if we go again consistent with hospitalizations, it's not exactly where we want to be. So we're going to have to see how this shakes out. Our last year's influenza season, our first cases started to occur in the first week of October. So if they are to be delayed this year by 2 weeks, similar to Australia, we'd be looking for the second or third week of October to have our first cases of influenza, or quote, the official start of the season, which is still early to have it start in October. So we're going to have to see how this shakes out. Hopefully the hospitalizations are not what Australia evidenced. Hopefully they're less, but we'll have to see. So what we have is, while Karen's getting the RSV, is here's a slide because it's given an update regarding our surgical wait list, and Rosemary Petrakis is on the line as well. So Rosemary, I won't hand it to you because I know you won't appreciate that, but stop me if I say anything incorrectly. So we have to remember, prior to COVID, we had close to 5,400 patients waiting for surgery as of March 19th, 2020. As of August of this year, positive note, we're down by 40%, down to 3,200. So that's very positive news overall. Even when we last reported this, in or around March of 2023, we had 4,600 patients waiting. We're down to 32, which is an improvement of 400. What we do look at too is what's called long waiters. And those are individuals who are waiting greater than their priority timeline as set by the province. And as of August 21st, there's been an 11% reduction of long waiters as compared to March of 2023. So we've had a significant improvement in the overall number of patients that are waiting for surgery, plus those who are above target has been dramatically improved as well. So we still have more work to do, but we're trending clearly in the correct direction since prior to COVID and even during COVID, and getting quote caught up with respect to the various backlogs that occurred during COVID. I don't know, Rosemary, if I missed anything.
No, I think the only thing is the strategies we put in place. The highest number of long waiter cases by service, we've been running those rooms later into the evening. We've also been operating on Saturdays and Sundays, even over the summer, and we've got some scheduled in September. And our biggest struggle for the operating room is our health human resources and its anesthesia.
Right. Thanks, Rosemary. No, perfect. Last thing I want to highlight is the positive benefits of the nurse police team. These were highlighted back a couple, 3 weeks ago. And actually just got off the phone with the police chief. What's interesting is what we're doing is tracking the individuals who are being seen in the community by the MPT team. And that's the team that has a nurse and a police officer from 1 p.m. to 1 a.m. on Friday, Saturdays, and Sundays right now. They go out into the community and make contact with individuals who either have a mental health and or addictions issue and might need some care or direction or some advice. And we have seen that it's about 40% less ED visits. So we are tracking the individuals who are actually coming in contact with out in the community. We're tracking their previous ED visits, frequency of that, as compared to their frequency of visits after we've come into contact with them. And we've seen basically a half percentage, 50% drop in their attendances to the ED after we see them. So we're able to avoid ED visits for the individuals we come in contact with in the community. So very positive. In addition, what it's doing is, as a result, that frees up more time for individuals who don't have those issues to be seen in the ED, let alone individuals who do have those issues but are high acuity level and need to be seen in the ED. That frees up the resources to see them as well. So very positive from that point of view. So we're extending this program for another few months to see how it's going. It's catching on provincially, internationally. It's been mentioned by some nurses on social media in New York State, et cetera, raving about it when they come across it on social media. So it's not only having a positive impact locally, but it's being noticed internationally, which is great. And the team's doing an amazing job, and they know they're making a positive impact. They can see it, they can feel it. And the staff who are working at the hospital and these individuals work back at the hospital recognize the benefits of it. So pretty proud of the team. And again, we started at 11 to 11, and it's the team that said, you know what, we think if we change the hours 1 to 1, will make an even bigger benefit. And sure enough, they did, and it happened. So kudos to them to, saying, hey, let's work till 1 o'clock in the morning, because we think it's going to be a positive benefit. So we're seeing people at a time of the day that they need help, where they need help. We're not forcing them to say to come to this address, from 9 till 4, Monday through Friday. That's not going to work. That's not the demand. This is the demand times, the demand hours, and it's having a positive impact. So can't be prouder of the nurse and police who are participating in this. It's been a significant positive benefit for our community, which is great. So, Madam Chair, that's my report.